What is a liquid facelift? That is a question. Dr. Dhesi, do you do liquid facelifts? Even from patients who've been with us for a while, I read something about liquid facelift. Do you do that? Hello and welcome to another weekly newsletter with me, Dr. Sunny Dhesi. I'm here at my clinic in Oakham in Rutland, a beautiful part of the world. Rutland, one of the smallest counties in the UK. And I'm here doing what I feel I do best, is adding value to those patients that come and see me, whether it's virtually, online, or whether it's in clinic, in here, as you can see behind me. What do we do here? What do I do here? So I am a GP and I'm also an aesthetic and wellness doctor. Our clinic is focused on supporting women, predominantly, and men as well, through their health and rejuvenation journey. So, I believe that healthcare systems are broken, especially here in the UK, but actually globally as well. And I don't think it's the fault of the individual practitioners. I think it's the systems themselves that are failing. And over the past couple of years, I've learned more and more that women's health is something that our health systems are not geared to cope with. More than 50% of the population, women, are not served well, and that is our focus here at Vysana. My focus is to support women through mindfulness, menopause, and medicine. So if you're interested, if you're a woman or if you're a man and you want to learn more, then please keep watching and hope you enjoy it. Comments are always welcome. Enjoy. So to start off, I'm a little disappointed. You're asking, why are you disappointed, Dr. Sunny Dhesi? This beautiful morning, you're recording your newsletter. Why are you disappointed? What's happened? Well, those of you who follow us on social media, on Instagram, on LinkedIn, all the other channels as well, will know that we were finalists in the National Aesthetic Awards. We were finalists for Best Clinic, Midlands and Wales, and we were in the finals for Best Non-Surgical Results. That means a rejuvenation result, getting tongue-tied there, a rejuvenation result that didn't involve surgery. So we submitted one of our patients kindly agreed for us to submit her before and afters, and we spoke about her treatment. I'm disappointed because we didn't win. That disappointment comes from not being able to reflect on the amazing patients that we have that come and see us, the investment that they've given into our clinic. So that's where my disappointment is. But I will say the people that did win in those categories, a shout out to Pure Perfection Clinic in Cheshire and Dr. Cormac McVeary, I think it is, in Scotland, who won the best non-surgical result there. Submissions were amazing. They are aspirational clinics and practitioners, and you know what? There's always next year. So hopefully one of our patients will agree for us to submit our results. And as always, what we're going to do over the next 12 months is continually invest in clinic, continually open up the clinic to patients, make healthcare, make rejuvenation accessible, and that disappointment will be a past memory next year. So hopefully, fingers crossed, we can make it to the finals again. But that's why I'm disappointed. But as always, I'm always looking forward to seeing patients. So if you are interested, you want to come and see a clinic that was in the finals, you want to see a practitioner who's in the finals for National Aesthetic Awards, then please do book in and see us. If you have already been to see us, please book in again. It's always great to see patients who are already on a journey and they might have taken a bit of a gap. So if you haven't been to clinic, come and see us. There are lots of changes and we're always innovating. What can I do about textured, bumpy skin? That is a question we get asked, I get asked a lot, whether it's virtual consultation or in clinic as well. So who normally gets affected by textured bumpy skin? So it can be anyone at any age. I think postmenopausally, probably not. Postmenopausal skin is generally predominantly either dry or dehydrated. I think in patients who are in their early 30s, if in your early 30s you're watching this, ears will prick up. It's usually as a consequence of if you've got your spots and breakouts under control, you're no longer getting big sort of discrete spots appearing or inflamed spots, but you've got this kind of texturedness, usually on the forehead. Most patients complain or are concerned that there's textured bumpy feeling on the forehead, and I think it could be anywhere in your 30s, so early 30s to late 30s, possibly as a consequence of over exfoliation. But actually sometimes this is where, shock horror, stop the presses, this is where we are going to talk a little bit about exfoliation. So exfoliation is great. I always am an advocate of chemical exfoliation, not physical exfoliation. So chemical exfoliation is through the use of AHAs, BHA, so alpha hydroxy acids, beta hydroxy acids, polyhydroxy acids. I'm using the term acid, and some of you probably scrolled on or switched off, but it's a gentle chemical form of exfoliation. So natural acids, for example, a form of AHA is lactic acid or mandelic acid. Lactic acid is derived from milk in layman's terms, and mandelic acid is derived from almonds. So these acids are very good at exfoliating the skin gently so that this textured bumpiness, which if I get my little overused model, is this bit of the skin that you can feel. So if we can smooth this keratinized layer using gentle exfoliation, that's where that bumpiness can happen. Now, in clinic, we do it very quickly with glycolic peels or salicylic peels or combination peels. But at home, you can do it gradually. You can use either, for example, we have a great product from Illumia called Bright and Clear, which is a lactic acid toner. That's this one. You can message us if you'd like to know more about that. Or there are serums. So what I generally recommend is still at this point in time, depending where you are in the world, use a nourishing cream cleanser for now. The summer's coming and we'll switch it up a little bit, but a cream cleanser still. Then use a serum that maybe has some AHA in it or some BHA in it. Some good examples are from Illumia and Obagi. If you're interested, we've got a virtual skincare service. And using it in the right way at the right time, and then putting moisturizer over the top and sunscreen. Over the next sort of 2 weeks or so, you'll find that maybe using it 2 to 3 times per week and building up to daily use will really help with that texture and bumpiness. And also, if you are older, if you're mid-40s and older, and you have rough skin, usually what I would say is drier skin, you can use once or twice a week an exfoliating regime. Now the weather's changing, we're drinking more water, we're more hydrated, we're internally hydrated, but skin hydration is something different. So, and we manage that through skincare. So I hope that was a useful tip. Bumpy, textured skin, very easy to take care of, but it just involves fine-tuning what you're doing with your skincare regime. Daily use, not to start off with. Build up to daily use by using it 2 to 3 times per week, probably once a day, and then building up to twice a day if your skin can tolerate it. If it gets red and inflamed, then you're overdoing it. If that bumpiness starts to turn into spots again, you're overdoing it. You need to protect that all-important skin barrier function. So what is a liquid face lift? That is a question. Dr. Dhesi, do you do liquid facelifts? Even from patients who've been with us for a while, I read something about liquid facelift. Do you do that? Yes, we do. We do liquid facelifts all the time. It's just a slang term or a media term to describe using combinations of wrinkle relaxing injections and dermal fillers or skin boosters. So yes, we do liquid facelifts. I just don't call it that because my approach is more holistic. So if in answer to that question, yes, so I'll go into a bit more detail because for those of you watching, are like, okay, well, if you do them, why don't you talk more about it? I think first of all, the products that we use are important. So we use specific brands that we know will help control our outcomes, our risks. The brands that we use, we know that if there are any complications, so wrinkle swellings and so on, or lumps, we know we can dissolve them. We have a very, touch wood, a low complication risk, and that is because of what we do in clinic for our patients. But let's go back to the main question, liquid facelift. So, as I said before, it's a holistic approach. It's kind of a mapping approach. It's a listening to you as a patient, what you want. Do I want my fine lines? I mean, mine are creeping in now, actually. But I know you're going to say you don't have any, but I haven't had wrinkle relaxing injections for a while. So these are starting to become more static. Frown lines, not so much, because I'm such a happy person, I don't frown very much, and lines around the eyes. So that is a wrinkle relaxing. I won't name the drug because we're not meant to. Ethical standards say that we shouldn't mention the actual drug that we use, but I think we all know what it is. So we can smooth out those lines and wrinkles. And we can also use that same wrinkle relaxing injection, for example, here around the mouth. We can use it in the chin. We can use it in these what we call platysmal bands here to reduce it. So wrinkle relaxing injections are a way of reducing muscle movement, and that's how we can relax the face and therefore reduce the lines that appear. Skin boosters, on the other hand, as part of the liquid facelift approach, are things that boost your skin. So my trusty model is back in use again. So here's your epidermis and here's your dermis. So skin boosters tend to inject them into the dermis here to plump out this section. They're not dermal fillers, but they are hyaluronic acid. Hyaluronic acid mimics the natural collagen that we have in that dermal layer, and it plumps out the skin. It basically, think of it as a really good drink of water for your skin that stays in your skin and is held there. It does wear off over time, but again, that is the liquid facelift approach. It's a combination. We've just used some wrinkle relaxing injections. Now we're moving to skin boosters, and then of course dermal fillers. So dermal fillers, I feel, are in the right hands. They're a great treatment modality. By that I mean that it makes a difference to your skin and your volume. You know, for example, here at the cheekbones, you know, we always do this. It helps to lift and plump up. It can help to contour the face. So that is the liquid facelift approach. What do we use in that? We can use things like I said, wrinkle relaxing injections. We can use hyaluronic acid. There are new combinations of more kind of permanent fillers and hyaluronic acid itself. So we call it I can't pronounce it, hydroxyapatite, which there are various brands of. I really probably botched that one up, but I can never pronounce it. But the approach, what I'm trying to get at, the approach involves mapping out the face, talking about your concerns, listening to your concerns. I always say getting onto the same page. You know, what really bothers you? What do you want as an outcome? We try not to treat individual lines. Like, oh, Dr. Sunny, this line bothers me. Okay, well, look, let's look at the face holistically. Where can we introduce treatments that will help overall? What you don't want is a rejuvenated lower face, which looks odd. For example, young looking lips, but the rest of your skin, your face isn't. So that is the answer to the liquid facelift question. So lastly, I wanted to talk about endometriosis. It's a topic of discussion in clinic. It's a topic of discussion whenever we go to conferences. And it's something that the startling fact is that 75% of women who are suffering with endometriosis will ignore their symptoms. Now, endometriosis can affect all women from teenagers all the way up to menopause. Obviously, post-menopause, the endometriosis can improve because of estrogen levels declining, but for a whole lifetime, a lot of women are suffering with symptoms. It's a disease that not only affects a physical state for women, but also affects their mental state as well. And 10%, so overall the statistics are about 1.5 million women in the UK and nearly 200 million women globally are affected. And I think why I'm adding this into the end of the newsletter is that it's just to get, you know, if I, as a 44-year-old male GP, am going to come online and talk about endometriosis just to spread awareness, then I think it's just to get that out there to help anyone that's watching this resonate that it's okay to go and discuss it with your GP. I would welcome that discussion. I think the road to management of endometriosis is difficult. It starts off with going to see your doctor about it. It's about discussing your symptoms, whether it's painful, heavy periods, pain on intercourse, abdominal pain, affecting you potentially on a daily basis or definitely as part of your cycle. Then I think it's probably time to discuss it. I think the facts, when we put it in terms of those women, whether you're working full-time, whether you're looking after your family full-time, it's very debilitating. It affects the quality of your relationships. So ending the video newsletter to help support awareness of endometriosis. I know what some people will say in the UK, especially when you watch this, it's really difficult to get hold of a GP appointment, let alone discuss it. But rather than suffering in silence, endometriosis is something that affects a lot of women. You don't have to put up with some of the symptoms I've mentioned. And part of going to the Primary Care Women's Health Forum conference last week was to help spread the word, to help anyone watching this to resonate that endometriosis is a real condition. It's debilitating. If you're suffering with symptoms, then do seek medical advice. You don't need to suffer in silence. The road is a bit difficult. It requires lots of different forms of treatment or management. Not all of it is medical. Some of it is lifestyle as well. But there is a good outcome in the end, especially once you know that you're not alone on that journey. So thank you for watching this week's video newsletter. I hope to bring you another one next week. If you have any comments, feedback, it's always greatly appreciated. I'm Dr. Sunny Dhesi. This is Vysana Life, and thanks for watching this week's newsletter.